Hello, and I'd like to welcome you to the Osterfield Clinic IBS program. A little bit about me. I'm a dual certified master practitioner of NLP and clinical hypnosis, but I've also studied various other techniques such as EFT, TFT, cognitive behavioural hypnotherapy, cognitive behavioural therapy and psychoanalytical counselling. Now, to understand the difference between the Osterfield Clinic IBS program and a normal hypnotherapy for IBS program, you've got to understand something called meta-medicine. Now, IBS is a problem for a lot of people. It's a problem that has clinically no physical reason. If you go to your doctor, they will tell you that the cause of IBS is not known, and to get diagnosed with IBS you've got to have stomach troubles, as you know, for about 6 months with certain symptoms before they basically turn around and give you the label IBS. And the label IBS means, IBS, we don't know what's going on here, there's no reason for it. Okay? So what I do and what meta-medicine does is, meta-medicine is the study of why things are happening in your physical body. So if you think of it like this, every cell in your body is controlled by your brain. That's not me, that's GCSE biology. Every cell in your body is controlled by your hormones and by the electrical pulses from your brain. So for something to go wrong in your body, from IBS to cancer to eczema, if it's not something that you've caught from the outside world, it's something that your brain has instructed the cells in your body to actually produce. Now, your brain's not going to do that without a reason. The human body has been evolving for millions of years, and it is perfect. So what we do with meta-medicine is we look at the medical process that is happening. We then look at what part of the brain is associated with that medical process as you're evolving and as you're developing when you're in your mother's stomach. Various parts of the brain are controlled by something called embryonic layers, and these also go into then forming the rest of your organs. So we look at which part of the brain is responsible for which organ and organ function in the body. We then look at what emotional things in the outside world are actually controlled and actually processed in that part of the brain. A great example of this would be eczema. We all know, and any doctor can tell you, that eczema is stress related, but we don't know what kind of stress, we don't know when it's going to happen. And most people say when they've got eczema that they can't understand it because the eczema starts after they've been stressed. You have a problem at work, or you've got a problem in a relationship. When the problem's gone, then the eczema starts. So how can it be stress related? But we all know that it is. Now think of that side of things like this. When you go to a gym, you do lots of exercise. After you finish the exercise, then your body hurts. A lot of processes in the body actually happen after the emotional event. IBS is actually a problem with actually dealing with an emotional situation that emotionally you feel like you can't digest. Physically, something's happening and you just can't digest it. So what I do, and I offer a no results, no fee basis on this work, is I will sit down with you to start off with. I will see if I can get a general idea of what might be causing your IBS, and this will be by email, questionnaire. I'm going to need a medical history from you, from your doctor, so that I can actually understand what the doctor thinks has been going on, and then a few questions about what might have been happening in your life 2 to 3 months before you develop the IBS. After I've done that, if I'm confident that I can actually understand and identify the exact issue that has caused your IBS, I'll invite you in for a consultation. At this consultation, we will narrow down the exact emotional conflict which you are finding difficult to digest. And this may be something with 2 emotions in it. So for instance, you might be at work, you hate your job but you really need to keep it. You've got 2 emotions and your brain literally doesn't know which one to go with. After we've found the exact cause of the IBS, I will then offer you a no results, no fee basis to clear that for you. This would take anything from 20 minutes to 2 hours. The most it's ever taken me is, I think, 3 2-hour sessions. Now, once we've resolved your IBS, you're free to live your life the way you want to. So all I really need you to do at this stage is literally get in contact with me, send an email or give me a call. All of my details are on the Osterfield Clinic. The first stage is very simple. It's literally just a couple of questions to get to know you and get to know what's been going on for you. and then after that, everything else is handled by myself and the team in terms of finding out everything we need to know and then getting you in for your appointment. We'll then work together, resolve your IBS, and you're free to live the rest of your life the way that you deserve to live. Thank you very much for watching this. My name's Richard Osterfield.